This animation gives an overview of the structure of the NHS in England and describes how the money flows. How public money is spent is determined by Parliament, and more specifically the Chancellor of the Exchequer. Money allocated to healthcare is determined by the Spending Review, which would usually occur every 3 years and amended annually by the Budget Report. Due to the uncertainty caused by the coronavirus pandemic, it was decided that the latest Spending Review in November 2020 would cover April 2021 to March 2022. The government department responsible for healthcare is the Department of Health and Social Care, which has the largest amount of pre-allocated public money, with an annual budget for 2021-22 of £156.5 billion. This is divided into £147.1 billion of revenue funding to cover day-to-day running costs such as staff salaries and medicines, and £9.4 billion of capital funding to pay for infrastructure and maintenance costs. Health is a devolved function, so this funding is only for healthcare in England, and social care is funded separately via local authorities. There will also be additional funding of approximately £22 billion for 2021-22 for the costs of the pandemic, including the rollout of the vaccination programme. This is in addition to the over £50 billion of extra funding that was received in 2020-21 to fund, amongst other things, NHS Test and Trace, and the procurement of personal protective equipment. From the budget, the Department of Health and Social Care has to pay its internal costs, fund 14 executive agencies and special health authorities and arm's-length bodies, the biggest of which is NHS England and NHS Improvement, who work together as a single operating model via 7 regional teams to support delivery of the NHS long-term plan. The plan was published in 2019, outlining the key ambitions for the health service for the next 10 years, to create a service fit for the future and get the most value for patients out of every taxpayer pound. NHS England and NHS Improvement receive the majority of the Department of Health budget, with funding for 2021-22 of £139.1 billion, which includes £3 billion of COVID funding to help tackle the elective backlog and mental health services. It directly commissions military healthcare, health services in the justice system for healthcare for children, young people and adults across secure and detained settings, and specialised services. There are 146 directly commissioned specialised services with a budget of roughly £20.1 billion. They are grouped into 6 programmes of care: internal medicine, cancer care, the trauma programme, women and children, blood and infection services, and mental health. The majority of NHS England and NHS Improvement's budget, £85 billion, is allocated to clinical commissioning groups, or CCGs. From April 2021, there will be 108 CCGs in England, a number that is decreasing. There were 192 at the beginning of 2019-20. These groups are clinically led and comprise mainly of GPs, but also include representatives from nursing, the public and hospital doctors. CCGs plan and commission services for their patients, including planned hospital care, rehabilitative care, urgent and emergency care, including out-of-hours and NHS 111, most community health services, and mental health and learning disability services. Since April 2015, primary care, or GP services, are co-commissioned by NHS England and NHS Improvement and CCGs. The budget for primary care is around £8.8 billion. In 2015, England was divided geographically into 44 areas, each with an average population size of 1.2 million, though it ranges from 300,000 to 2.8 million. NHS organisations and local councils were asked to collaborate and develop plans on how they would meet the health and social care needs of their populations. These groups are known as Sustainability and Transformation Partnerships, or STPs. STPs are now evolving into Integrated Care Systems, or ICSs. ICSs are alliances of providers such as hospitals, community services, mental health services, GPs, and may even include independent or third sector organisations that decide to work together to deliver care rather than compete. By April 2021, it is planned that all STPs should evolve into ICSs. It is likely that funding will increasingly be distributed at ICS level. There is an intention to move towards one CCG per ICS, with commissioning on a more strategic basis. Another key aspect of the long-term plan was the creation of primary care networks, or PCNs. PCNs are made up of neighbouring general practices, covering a population of between 30,000 to 50,000 people. £1.8 billion of the £2.8 billion promised over 5 years in the NHS long-term plan will come through the network contract rather than directly to individual practices. So in summary, money flows from Parliament via the Department of Health and NHS England and NHS Improvement, and in the most part clinical commissioning groups to the organisations that provide patient care. However, there are many organisational changes coming, with a shift to system working. There will still be a role for commissioners, but it will look different. 2021-22 will be a key year to start to see what these changes look like and how COVID affects this.